Hi guys, this is Amanda Lee, and today I'll be talking about classification of heart failure and MET levels for our cardiac patients. So first we're going to start with the New York Heart Association's functional classification, which is the most commonly used system to assess the stage of heart failure. It's divided up into two components. The first we'll talk about is functional capacity, which is how a patient with cardiac disease feels during physical activity. The second is objective assessment. So there are four classes under functional capacity, 1 through 4. Class 1 is patients with cardiac disease who do not have any limitations in their physical activity. Class 2 is patients with slight limitations in the amount of physical activity they can do. They're comfortable at rest, but ordinary physical activity results in fatigue, palpitation, dyspnea, or angina pain. Class 3, the patients have marked or noticeable limitation in their activity. Again, they're comfortable at rest, but less than ordinary activity causes heart symptoms. And lastly, class 4 are the patients who have the inability to carry on any physical activity without discomfort. So the symptoms of heart failure or angina syndrome may be present even at rest. And if any physical activity is undertaken, discomfort increases. So the second way to classify a heart failure patient is through objective assessment, which is based on measurements through x-rays, echocardiograms, and other imaging and tests. So again, it's divided up into 4 classes, this time A through D. Class A, patients have no objective evidence of disease, no symptoms, and no limitation in physical activity. Class B, there's objective evidence of minimal cardiovascular disease, mild symptoms, and slight limitation during ordinary activity. They're comfortable at rest. For Class C patients, there's objective evidence of moderately severe cardiovascular disease. There's marked or noticeable limitation in their activity due to symptoms, and they're comfortable really only at rest. Lastly, for Class D, there's objective evidence of severe cardiovascular disease, which results in severe limitations and symptoms even at rest. So those are the 2 ways to classify heart failure patients. So next we're going to do a brief overview of MET levels. You can find a more detailed list on the handout. But here I'm going to talk about 5 different categories, starting with light activity. This ranges from 1 to 3 METs. 1 is bed rest with no activity. 2 to 3 METs includes doing ADLs while sitting edge of bed, standing, or slowly walking. So walking at 2 miles per hour, grooming your hair, getting dressed, and typing on a computer all fall under the light activity category. Light to moderate activity is 3 to 4 METs, and this includes showering, driving with doctor's approval, climbing stairs, and walking 3 miles per hour. Moderate activity is 4 to 5 METs and includes playing golf, ping pong, sex, and brisk walking at 3.5 miles per hour. Next is heavy activity at 5 to 7 METs, and this includes walking 4 to 5 miles per hour, cycling at 10 miles per hour, digging a garden, or playing tennis. And lastly, very heavy activity is 7 METs and up. This includes vigorous exercise and competitive sports. I hope this video was helpful for learning about heart failure classification and MET levels. Thanks for watching.